Good afternoon, once again. Just now I stepped out of the CCSA daily meeting room, which is right next to the studio. I was observing the meeting. There is much discussion going on. One issue being discussed is actually with the Deputy Governor of Samut Sakhon Province by video conference. And they were discussing the various measures put in place so far, the implementation, the enforcement. And of course, we hope that the situation there will get better in Samut Sakhon because the numbers now are better. And there was also discussion that tomorrow on Thursday during the daily morning CCSA meeting, we will be discussing the proposals for various more flexible measures for new recategorization of the provinces. So the discussion for that will be finalized tomorrow as proposals on Thursday, and the proposals will be submitted to the general CCSA meeting, which will be held on Monday, the 22nd of February, next Monday, for approval by the director of the CCSA or the Prime Minister. So I'll start off with the general situation as always. The numbers that we have confirmed, the numbers aren't that high as the past weeks. In detail, we have new confirmed case for today recorded as 175, as you can see on screen. Out of that number, 175, 114 cases are from active case finding. 7 are from those who traveled back from abroad and who had entered directly into the state quarantine. The new recoveries we have for today recorded is 134, so slightly lower than the new cases confirmed today, but at least it is in the hundreds and lower than 200 for both cases. The cumulative number we have since last year, 24,000, almost 25,000, and the recoveries and those who have been discharged, over 23,000, as you can see on screen. Active cases still under treatment in hospitals, in field hospitals, in quarantine, is 1,182, as you see on screen. Hoping this number will reduce in due time. Fatalities stands at 82 fatalities, no additional to be reported for today. The charts and numbers and information that was presented by Dr. Tuwisin just now showed a differentiation of nationalities of those who were tested positive in the recent days, as well as different age groups, as young as 1, as young as 5 years old. So we must take much precaution so that this pandemic will not affect our young children. The one important, interesting piece of information is about factories. It's the new concept of good factory practice, or GFP, and you have on screen for you there. The Ministry of Labor has come up with this good factory practice and have been in contact and in coordination with the various factories affected or at risk, in talking to them on how they can better improve the different measures and the different practices. As you know, in factories, in different industrial locations, there are a lot of protocols, a lot of practices, good labor practices, all the mechanical, technical, all the configuration of machines and the like. So the good factory practice that the Ministry of Labor is discussing with the hundreds or thousands of factories in Thailand is very important. Most focusing on the measures that they can maximize and scale up in order to prevent the spread of COVID in their own factory. So that's one picture for you of this discussion that's going on with many factories. And talking about factories, right now in Samut Sakhon in particular, around 1,104 factories in the province of Samut Sakhon had already been tested for active case finding. Totaling a number of 89,850 persons being tested through active case finding in Samut Sakhon province. And I'll go into a bit detail in that later. The spokesperson had also mentioned about one new emerging case, which is at the Thammasat University Hospital involving a young doctor there, and he had showed a timeline there. So that is being looking into and then being investigated. As you recall, yesterday we talked about the Chulalongkorn University and its hospital, the case there. Now this new information is about Thammasat University Hospital. So rest assured we'll be looking into detail in controlling that case. Firstly on Pathum Thani, and then I'll move to active case finding, which was recapped by Dr. Thuisin. So on Pathum Thani first, today we see another rise in the number of confirmed cases in Pathum Thani, which found 71 infected persons from the number of active case findings. We had 114 positive cases from active case finding today, 114, which is part of the 175 new confirmed case for today. So out of that 114, 71 are from active case finding in Pathum Thani, and most of these cases are related to three main fresh markets in the province of Pathum Thani. The markets of Suchat, Talat Suchat, Talat Rangsit, Talat Pornpat. These are the Pathum Thani fresh markets which have been related to the cases and had prompted the provincial administration of the province to order the closure of the markets prior until the 25th of February. And the provincial administration there had also issued an order to use buildings around these markets as quarantine facilities as well. So the spokesperson also showed us some graphics about the configuration of market stalls, sort of like the square tables and market stalls, the stalls in the market where vendors sell their produce. And some of those stalls were colored in red, some in white. So those in red were, and we'll have a picture coming up there for you, just for visualization there, yes. So in red are those stalls of vendors who had actually been tested positive, and the ones in white are their neighboring stalls, which were not tested as positive. The result came negative. So this is basically the level of detail which we are delving into in terms of trying to root out the positive cases in congested areas, in risk areas, such as these three fresh markets in the province of Pathum Thani. Moving on to the active case finding. The number of active case finding being conducted in high risk area continues, as we mentioned often. Since the start of the current outbreak, more than 89,000 persons have been tested through active case finding in the province of Samut Sakhon, and I mentioned that exact number is 89,850. For Pathum Thani, the recent cluster of confirmed cases from the fresh markets discovered in Pathum Thani also led to more than 8,000 people being tested through active case finding. 8,000 in Pathum Thani, in areas surrounding the fresh markets where the outbreak had been discovered. In Bangkok, according to the Ministry of Public Health, more than 40,000 vendors, 40,000 vendors and workers in fresh markets in Bangkok have been tested, with only a small number, around 14, returning positive. Furthermore, 16,000 factory workers in Bangkok have also received COVID testing, which shows the result of only 0.4% of infection rate. So not so high in general in Bangkok, either through active case finding or through the COVID testing itself. However, we received some inquiries whether there should be more active case finding in other areas outside of the high-risk zone. So according to the Ministry of Public Health, testing is already provided free of charge to those who have been in close contact with confirmed patients. Those who have symptoms or have been traveling to high-risk areas can get consultations with doctors at any public hospital to be evaluated whether they should be tested or for the virus or not. So thanks to the disease control measures and the cooperation from the general public, from all of you, we have been successful in limiting the spread of the outbreak this week, with only 18 provinces having discovered new confirmed cases. However, conducting widespread testing in low-risk areas will create unnecessary pressure on the healthcare system and medical staff. So for the time being, we opted to do that. It is important for us all to be more conscious in our own health and safety by accepting the new normal way of life, which would reduce the strain on the healthcare system. So as mentioned in the previous briefings, each situation, each country, each case cluster during the pandemic has its own context. And in Thailand, we have opted to choose the active case finding missions as the key and important activity and way in which we will seek out the positive cases. And this has proven to be quite successful. Our numbers are quite lower. We've rooted out a lot of positive cases, placed them in proper quarantine and into the medical system. And the numbers aren't that high. As you can see, I mentioned in Bangkok, not that high. Bangkok, of course, is the capital city, the most congested city in Thailand. And the numbers are not that high. The factory workers I mentioned, only 0.4% of infection rate. That's very good so far. That's very good to date. Very good and very heartwarming to hear from this cooperation from all of you, from the general public, from all the workers as well. No matter what nationality, no matter what age you are, or no matter what profession you are. This is all for you. It's all for us. So just in closing, before ending today's briefing, I'd just like to give you some updates, just briefly, because it was in the press as well, on the vaccination plan. So yesterday, the Prime Minister confirmed, and also the Public Health Minister, that Thailand will receive the first 200,000 doses of vaccines on the 24th of February, if nothing else goes wrong. After the arrival of these vaccines, the health officials will take 3 more days to prepare for the first administration of the vaccine. There is as you know already, a draft planned proposal for the distribution plan already, but this plan will be further discussed and approved by the CCSA final approval in the meeting, the general CCSA meeting early next week, in which the Prime Minister will be chairing. So this is basically what I have for you today. Dr. Tuisin, the spokesperson, mentioned that he will be on provincial travel from tomorrow onwards for a couple of days in his capacity as the Inspector General at the Ministry of Public Health. So we will be having the assistant spokespersons for Thursday to Sunday for the Thai language edition. As you'll be familiar, Dr. Bird, if you can understand the Thai language, the briefings were held by Dr. Bird and Dr. Bum, the two assistant spokespersons for the Thai edition. For the English language edition, basically we will be having myself for the next few days. From time to time, there might be an alternate person to come and perhaps change the tone of presentation a bit, just in case some of the English language audience might be too familiar with seeing me. But perhaps starting on the weekends, maybe not this weekend yet, maybe the next weekends, we'll be having perhaps some people to assist in the English language summary, which we hope you find very useful as always. So thank you very much for your attention today. Have a great rest of the work week today. Stay safe and please stay healthy and take care of one another. Thank you. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณ